Hi, my name is Afonso. I'm a biomedical engineering and biophysics master student at the University of Lisbon, and today I'm going to tell you a little bit about my work. Glioblastoma is a brain cancer, a deadly one, since stats show that only 1 out of 4 patients survive for at least 2 years. Therefore, it is important to assess how patients respond to surgery, radiotherapy, and the other treatment strategies. How do we do it? Well, tumors have a smooth tooth, so to receive more sugar, they build more blood vessels and more blood arrives. Or, like scientists prefer to say, there's an increased perfusion, which we can measure with perfusion MRI, namely a contrast-free technique that I use in this study called ASL. The thing with perfusion MRI is that resolution is much worse than in anatomical MRI. Stand with me. If right now you are seeing me with an anatomical MRI resolution, now you are seeing me with a perfusion MRI resolution. I'm sure you got it. When we have such poor resolution, different parts of the tumor may be in the same voxel, pretty much like when we make a milkshake. My work was trying to understand how mixed the fruits are, but with more serious stuff, the different tumor regions, edema, enhancing tumor, and necrotic core. I defined a threshold such that, as it increases, the more difficult it was to accept an ASL voxel as belonging to a certain tumor region, in a way that, if the threshold is 100%, only pure voxels of a single region are accepted, and while varying the threshold, I was determining the mean perfusion for each region. The results show that the presence of different regions within the same voxels clearly affect the mean perfusion in each region. Moreover, when we become more strict with the belonging requirement, the edema perfusion tends to reduce, and the nascent tumor perfusion tends to increase, suggesting the presence of voxels where both regions are mixed, or if you prefer, milkshake voxels. We call those partial volume effects, and yes, it seems to be the case that they exist in ASL images across glioblastoma regions. Such information may be useful to obtain more accurate perfusion results, leading to better treatment options and reducing recurrence.